So, hello and welcome. We are discussing the chronic disease from Robert's philosophy. And we have already told that this is the book which is the easiest one, and the first one should be our first choice to read to understand, in order to understand the chronic diseases. We have left at page number 193. I don't know what paragraph number it is, but we were discussed in the last class about uh, the in children afflicted with this underlying condition, we find retention of urine. We have discussed retention of urine due to fear, due to fright in old people, in children. Today we will go on from next paragraph onward. Can you see this? Can you locate this in your book? Robert's philosophy, disease classification. Can you open this chapter, this paragraph in your book? Okay. This paragraph in your book. Please open this paragraph in your book and start reading. Our method, we have already told, our method is to read, understand and apply. Okay, so we have to go through. We don't know how painful it is or how disinterested it is, but this is our method and we will try to follow it, to go to the text and read and try to understand, then apply. So please open this paragraph and read. Got that?
Yes, okay, sir.
Okay. Please
From
read.
Hannibal, from here, sir.
Many symptoms of this stigma.
Yes, sir. Many symptoms of this stigma are reflected in the sexual sphere, especially in women. In other words, these are functional disturbances closely related to the emotions and dysmenorrhea, amenorrhea, and many other conditions result. Hahnemann tells us that grief or sorrow, such as that caused by an unhappy marriage, will produce more serious and distressing symptoms in the psoric patient than the most unfavorable surrounding or real hardships. It can be seen
Underline
that
this.
there would
Grief
be
and sorrow. Underline this. We have discussing this since the very beginning, that this grief and sorrow is just affecting psoric patient like anything. Okay, we have read it in vertigo, we have read it in headache, we have read it in other complaint, that the one of the exciting factor for this latent psora to arouse into the full-fledged disease is grief. We have discussed that the grief and sorrow, if the patient is just going downward track in health after marriage, you have to check two things: on the emotional sphere, whether it was disturbed, or on the sexual sphere, whether the other partner was afflicted with psychosis or syphilis and that has been transmitted to the spouse. Okay, on the emotional sphere, if it was grief and sphere, think that it is the predominantly psoric miasm which have been aroused by this mismatch. Okay, the patient is not happy with the marriage. Clear? So after marriage, this is one of the very basic history we get when all the problems started. Dr. Saab, it all started after I got married. And why? Try to find out this obvious cause, whether this was a mismatch or the other spouse was afflicted with the gonorrhea or syphilis. Okay? And emotionally more disturbed psora aroused. Emotional reactions will arouse psora any more than any other miasm. Okay, everywhere in the vertigo we have read, in the headache we have read. In other complaints, this is the emotional disturbance which is acting as a prime exciting cause for the psoric patients. Okay, remember, psoric patient, I am calling psoric patient, that means predominant psora. Pure psora are not available nowadays. Predominant psora is what we are calling psoric patient nowadays. Okay, predominant syphilis, pure syphilis tent, pure syphilitic tent is not available. Pure psychotic tent is not available. It's all about mixture, complex disease, complex natural disease or complex artificial disease or natural and artificial disease combining with each other to form a diathesis, a state. Whenever we are referring as a psychotic patient, we are referring as it is a predominantly psychotic, a predominantly syphilis, a predominantly psoric. Okay, so this grief is arousing predominantly psora patient more than any other miasm. Next.
The psoric skin is dry, rough. Sorry. The psoric skin is dry, rough, dirty, or unhealthy appearing. In fact, the classic psoric remedy is sulfur. Although it is not to be thought that sulfur will cure
Underline
all the.
psoric skin is dry, rough, dirty, or unhealthy appearance. Underline this. This dryness is a hallmark of psora. Everywhere you will get dryness. Dryness of the eye, dryness of the auditory canal, dryness of the throat, dryness of the skin, dryness of the hair. Okay, all these are dryness is the hallmark of psoric manifestation everywhere. We have told that you can add any sensation to these following sensation to any other complaint. Okay, burning everywhere, burning like hellfire. Okay, psora. Dryness everywhere, psora. Lusterless, okay, rough everywhere, psora. So these are some symptoms you will pick up for your answer in your examination, whether they are asking about head symptom of psora, they are asking about ear symptom of psora, eye symptoms of psora, add burning, add dryness, and the symptom will be completed. Okay, the classic psoric remedy Robert is telling is sulfur, and now we have already compared sulfur and psora. The only difference we have found in sulfur and psora is the sulfur is predominantly hot medicine and psora is predominantly a chilly state. Okay, that doesn't mean sulfur is not an antiseptic medicine. This is an exception, and exceptions don't make a rule. Remember that. Sulfur is the king of psora, both according to Hahnemann and many of our stalwart. Next.
Although it is not to be thought that sulfur will cure all cases, nor is it limited in its range of applicability to psoric conditions. But if
Okay.
there is
Understood
any
this line? Understood this line? What he's telling? What he's trying to tell? Understood this line?
Yes, sir. In all cases, sulfur is not applicable.
Sulfur can be utilized in any other condition also. Psychotic condition, syphilitic condition. Let me show you a line in Sorinum. What is Sorinum? Sorinum is predominantly an antipsoric medicine, is it not? And you will be surprised to see this line in Sorinum. Open Sorinum and see chronic gonorrhea of years duration. Try to find that line where there is a recurrent constipation, diarrhea, enuresis. Chronic gonorrhea of years duration. Got it?
No, sir. Yes, sir. Chronic gonorrhea of years duration that can neither be suppressed nor cured.
What is gonorrhea? Gonorrhea is pure psychotic manifestation, and Sorinum is helping out there. Is it not?
Yes.
So that means every medicine have all the elements of different diseases. It is बोलते हैं ना कि आदमी अपने जो predominant adjective होता है उसके साथ जाना जाता है. ओके, एक मुहावरा है कि आदमी अपने गालिब सिफात के साथ है, प्रीडोमिनेंट एडजेक्टिव के साथ है। वीरप्पन को, ऐसा नहीं है कि वीरप्पन में कोई अच्छाई नहीं थी, वीरप्पन में अच्छाई थी, बट वीरप्पन को डकैत ही माना जाता है। वाई? द प्रीडोमिनेंट एलिमेंट वॉज ऑफ डकैट इन वीरप्पन, वॉज अ बैड एलिमेंट, प्रीडोमिनेंटली अ बैड एलिमेंट। ओके, सो वीरप्पन किस नाम से याद किया जाता है? डकैत के नाम से, बुरा आदमी के नाम से याद किया जाता है। गांधी जी में ऐसा नहीं हो कि कोई बुराई नहीं थी, बट गांधी जी को अच्छे नाम से याद किया जाता है। वाई? बिकॉज आदमी अपने गालिब सिफात के साथ जाना जाता है, प्रीडोमिनेंट एडजेक्टिव के। इसी तरह से सोराइनम हैव अ प्रीडोमिनेंट एडजेक्टिव टू इट। Okay, that is why it is being called as antisoric medicine. But there are some psychotic element also, there are some syphilitic element also. Like sulfur is a predominantly antisoric medicine, but there are some syphilitic element also, there are some psychotic element also. But what is the predominant element in it? Predominant element is Psora. That is why it is being called as antisoric medicine. That is why whenever you are being asked in your examination, that is often a tricky question for Viva, when examiner is wanting you to give honors, to answer, score honors, they will ask you this type of question that okay, sulfur सिर्फ सोरा में यूज करेंगे? तो नहीं सर, हम इसमें भी यूज कर सकते हैं। Why? तो आपको ये जवाब देना होगा, predominant character, predominant element is of that, that is why it is being called as this. Clear? So Sorainam, according to my experience, is one of the very good anti-syphilitic medicine. Okay, Alan is saying that this is in gonorrhea, that psychotic element. According to my experience, in some very bad cases of syphilitic tint, Sorainam was helpful when there was skin eruption. So Sorainam is very good, means a very good remedy in persons who have a predominant syphilitic base and primary or the manifestation of the Psora, syphilitic base with the manifestation of Psora. One of the skin eruption I have seen in one of my patient, the patient eventually have died out of that disease, but after our medicine, the patient have committed suicide. Okay, at last he was under my treatment for many years. He was suffering from Wilson's disease, a child of 14 or 17, 14 or 17 years. I was seeing him from internship. Okay, after our long treatment, prolonged treatment, finally he was getting eruptions on his hand, and it was get cured with a single dose of Sorainum 30. Many years after treatment, in lockdown, he just left the treatment because he was living in Barasat, and finally he committed suicide because of this means missed treatment for long 1 year, and all of a sudden one day I heard that patient have committed suicide. So this was the syphilitic element in him, which all of a sudden, due to not proper treatment for 1 year duration, he committed suicide. But when he got a eruption on his hand, it was cured with, means it was get well with the Sorainum 30 one dose. Okay, so that was the case when I have learned that Sorainum, one of our senior at my PG have told me that Sorainum has a syphilitic base, and I decided to try it in that patient, and that patient was having a marvelous result with Sorainum 30, both in skin eruption as well as in his general condition. Okay, and he committed suicide at last, is the proof that the patient was carrying a syphilitic taint with him. Plus, he was suffering from such a dreaded disease, metabolic disorder of copper metabolism. Okay, so Psora and syphilis are the combination which we usually see in Sorainum. Okay, now that was a side topic. Now return to our main topic. Psora, the fact that classic psoric remedy is sulfur, although it is not to be taught that sulfur will cure all the cases, nor it is limited in its range of applicability of psoric conditions. Next.
But if there is any one remedy which we may limit by saying that it is the picture of a stigma, we may truly say that Psora and sulfur are so like each other in many instances that each typifies the other. In appearance, the psoric patients are the great unwashed Bathing is unwelcome and aggravation the roughness of the skin and the irritability.
Okay, and what is a sulfur patient? Sulfur is a ragged philosopher. What Kent is saying, Kent was a person that picturized the Materia Medica. Okay, so if you want to read the picture of Materia Medica, the best book is of Kent and Tyler's drug picture. They have personified the medicines. Okay, this medicine will look like this. Sepia, think of sepia, and you will think of the best description of sepia is given in Emil Tyler, who was eventually the student of Kent. Okay, so I was telling that if you want to read the picture of sulfur, picturize, personification, how a sulfur patient looks alike, go to Kent's Materia Medica and you will get a term ragged philosopher. What Kent is saying, that he will wear the shirt if he is not having a caring wife. He will wear the shirt until the shirt is fall off his body. Means he don't want to change it. So dirty appearance. Okay, so this is a great unwashed appearance of Psora and great unwashed appearance of sulfur. Okay, next.
In all psoric condition, itching is a persistent symptom. There is very little suppuration. There may be a few vesicle or a papular manifestation. Psoric eruptions are not noticeable by their color, but by the roughness of the skin.
Underline this. What is the color of syphilitic eruption? What is the color of syphilitic eruption?
Red.
Brown.
Very good. Go to syphilinum. Go to syphilinum. In Allen's, whenever I am telling without referring any book, that means Allen's keynote. Allen's keynote should be with you every time. And you will get the 1, 2, 3, 4th paragraph. Red coppery colored spots. Red coppery colored spots. Okay, this is peculiar color of syphilitic eruption. Coppery color. Okay, copper तांबा जैसा होता है, not पीतल. Okay, copper. तांबा. Okay.
Yes.
Next. So it is not identified, noticeable by color, but by roughness of the skin, and suppuration will not be there. If there is suppuration, that means the admixture of any other miasm is there. Okay. Next.
Unless there is marked inflammation, they are the same color as the skin. With a dry skin, there is a decided tendency for fine, thin scales. The eruption dry down and scales off.
Okay, underline this.
Erysipelatous.
Underline this. Fine, thin scales. Tell me a medicine with is having scaling. Profuse scaling. Profuse scaling.
Arsenic.
What you are telling, Priyanka?
Calamine arsenic, Cali ars.
Arsenic, not arsenic. Priyanka is ars iode. Okay.
Yeah. Ars iode and Cali
Ars
arsenicum.
iode. Cali
Ecthylum.
arsenicum. Ecthylum. And
Suriname also. Scaling
what,
is
Sunil,
there.
you are telling?
Cali mure.
Sunil, what's the Cali mu? Actually, Cali sulf.
Yes.
Okay, Cali sulf. Ars iode and all other medicines, what you have told, Priyanka, plus add to that Cali sulf. Profuse scaling. Okay, you will get it in boric. So this Cali sulf and ars iode, and these are ars iode is predominantly a tubercular medicine, Psora and syphilis. So if there is any admixture with the Psora, there will be profuse scaling. Sora alone can produce scaling, but this thin, fine scales. Okay, but with the admixture, it will produce more scaling. Next.
Erysipelas manifestation are a combination of Psora and psychosis.
Underline
If
this.
there is
This
any
is often an MCQ in your examination. Okay, underline this. They will ask this. Next.
if there is any syphilitic taint in combination with the psoric base, the patient are very apt to be susceptible to impetigo. For
Underline
this is
this.
the soil
Syphilitic tent plus Sora. Emptigo. Emptigo is a what is Emptigo?
bacterial infection, pustular formation
It
around
is
the
the
mouth.
Okay. What is
Bacterial infections of
bacterial
pustules
infection?
formation.
Okay. Pustule formation. Okay. And Priyanka?
it is contagious spreading inflammation of that skin around, especially the oral mucosa and nasal mucosa. And this is bacterial in origin,
Yes.
and the lots of pustular eruptions along with this thin, sticky golden discharge is the
Yes.
hallmark
That
of
is the
impetigo.
hallmark of this impetigo. See, bacterial infection, correct. Around the mouth, correct. Predominant age group,
Child. This is
Children,
mostly in the children.
children. Okay, children. Predominant age group, children. So whenever you are finding this impetigo, this is combination of Sora and syphilis. Sora and syphilis. Please next. Please read next.
if there is an sorry, impetigo, for this is the soil in which impetigo flourishes. Without these united taints, a patient will not become infected with impetigo.
Okay.
The psoric patient has a symptom of coldness associated with even slight ailment. With headache, there is a deadly coldness that is almost worse than the headache itself, and this is much aggravated by continued effort and relieved by lying down where it is warm and quiet.
Okay, this is a common modality of Sora you are getting everywhere. Okay, underline this concomitant coldness with even slight ailment. Okay, name a medicine deathly coldness of forearm in hydrocephalus. Deathly
Arnica,
coldness of forearm. Arnica, very good. Arnica. Deathly coldness. Whenever we are getting in Allen's these type of with symptom, okay, in hydrocephalus, deathly coldness of hand, these type of concomitant are very important. Okay, that is a side topic I have discussed. That arnica got a symptom deathly coldness of forearm. See the book and you will find it. Okay, hydrocephalus, deathly coldness in forearm of children. In diarrhea, in bracket bromium. In diarrhea, coldness, in bracket, there is bromium. Chilliness with any other complaint, especially with the pain. Medicine,
Pulsatilla.
chamomile,
chilliness,
and pulsatilla.
pulsatilla. Pulsatilla. Okay. And there are many other symptoms you will finding in your brain rolling around and shuddering or chilly or like electric like shock with any other complaint. These are the concomitant we are utilizing. And remember, whenever you are getting a physical complaint, physical concomitant with a mental symptom or mental complaint with a physical symptom, these are important. Okay, and coldness associated with even slight ailments, this is psoric concomitant. Think of Psora. Okay, burnt taste in mouth is a psoric concomitant. Think of anti-psoric medicine. Okay, next.
Modern medicine tells us that migraine has as its underlying cause emotional disturbances. In other words, this is a verification of Hahnemann's teaching on the disturbance roused in psoric patient by grief, sorrow, or other harrowing emotions. It kills
Okay,
the
wait
psoric
here.
patient.
Migraine is a diagnosis of exclusion. Migraine is a diagnosis of exclusion. कुछ नहीं मिलता है. There are so many diseases which are the diagnosis of exclusion. कुछ नहीं मिलता है तो ये होता है. सब exclude कर दिया तो अब ये बचा. Headache हो रहा है. There is no other cause they can find. EEG करा लिया, CT scan करा लिया, other test करा लिया, but कुछ नहीं मिला. So they are telling this is migraine. Okay, migraine is basically nothing but sudden collection, congestion of blood in the arteries of the brain. This is, they are calling migraine, and this is basically a psoric manifestation. Headache, if it is peculiarly of psoric nature. Okay, migraine for us may be of syphilitic type, maybe of psychotic type. Okay, but whenever you are getting this type of headache, psychotic or syphilitic, search for some pathology and be aware of that. If this is, you may find the pathology in the sinus. Often this sinusitis, frontal sinusitis or modal sinusitis are causing migraine. Okay, but migraine of the Psora are purely functional, and that is the sudden congestion of the arteries of the brain, and these are basically of emotional, due to emotional disturbance, some sudden shock, some grief, some emotional upset in the life history of the patient, which is causing this disease. And headache, you have to classify it according to these modalities, localities, okay, and time of aggravation or onset. What was the time of onset? If it was started after accident, then you will think a set of medicine. If it was started after emotional disturbance, you will think of other medicine. Okay, but the peculiar migraine is a type of psoric manifestation. Clear? Next.
It kills the psoric patient to stand still. He must walk instead of standing, even if he is on his feet, but a brief time. He may stand if he can lean against anything sufficiently to take the weight of his feet. This is not because of structural changes, it is because of his natural desire to rest, with his characteristic restlessness. Weakness of the ankle joint is a sure indication of the presence of syphilitic taint in combination with psoric stigma.
Okay, this is another line. Underline this. You have many medicine which have the weakness of ankle joint. Just think and you will get that there are medicines which have easily turning ankle. Carboanimelis, ankle joint, easily spraining. Okay, Lidampal, easily turning of ankle, and many other medicine you will find in your Materia Medica. This is sure indication of syphilitic taint. Even weakness of any other. Cannabis indica. Okay, sorry, cannabis sativa. What you are getting? You are dislocation, easy dislocation of patella. Okay, easy dislocation of joint. These are nothing but the syphilitic taint admixture with the Psora. Okay. Now, this, it kills the psoric patient to stand still. They cannot stand for long. Standing is a worse position for sulfur. Standing is a worse position for Psora. Okay. Now, from now onward, you start just seeing the patient outside your OPD in the queue. You will see some patients are leaning at the door. One of us are used to show this attitude. That see the patient is leaning. He cannot stand still. But there are some patients who are standing there. But some patients are just try to lean out the wall. You just go to the gallery of NIH or your hospital and you will see some patients are standing in the queue and some patients are leaning on the wall. Those who are leaning on the wall are, you can say, are predominantly of psoric origin. This is the utilization of physician's observation to diagnose the miasm. Okay. Clear? This is not due to any structural changes. This is not due to any structural changes, but due to the natural tendency of Psora to rest. Okay. Now, next chapter is Psora or deficiency. This is Robert's own theory. Robert's own theory. We won't discuss this. Okay. Psora or deficiency, we won't be helped. That Robert has tried to convey that all the deficiencies are of Psora. Okay, And Psora is nothing but deficiency. We don't believe in that idea that all the deficiencies are of Psora, all the nutritional deficiency are of Psora, because there is deficiency due to some structural changes in the body. Okay, body is not able to assimilate that, and that is structural changes point us towards other miasm. Okay, there are some other miasms which are causing deficiency, so we are not subscribing to this idea wholly and solely. Okay, but yes, deficiency are Psora, but every deficiency are Psora, we are not going to subscribe to this idea. And every Psora will produce every kind of deficiency, this is not. Okay, so there are some overlapping of the idea, so we will leave this chapter, a very big chapter, a very complex chapter. This is not useful for our clinic, so we won't go through it. Next chapter, some manifestations of latent Psora. Some manifestations of latent Psora. Read this. What is latent Psora? What is latent Psora?
Dormant condition.
In dormant condition. When the Psora is in dormant condition?
When the
When the
or circumstances are favorable, the Psora is in dormant condition, but unfavorable circumstances, it gets aroused and it will produce a lot of signs and symptoms.
Very good. Where it is written, can you give me the reference of the organon? We have read it there in the one of our aphorism in the organon. Not only Psora, every miasm lies in dormant condition, and unless and until we have read the development of miasm, haven't we? We have read, no. Suppose this is organism. Okay, this is the moment of infection. We have read there are 3 stages of development of Psora. Okay, or any other miasm. First stage, second stage, third stage. This we have read from chronic disease. Okay, this in first stage, infection. Moment is required for this infection. Okay, moment is required for this infection. Infection what? Now the disease will go and develop in the whole of the organism. Okay, we have read this in aphorism also. 204 to 206, like that. The whole of the organism is impregnated. Okay, whole of the organism. Uske baad kya hoga? This was the second stage. This was the second stage. And third stage, and the third stage is, it will show itself on the surface. Okay, that is the primary manifestation. Okay, this is the third stage. Third stage. Okay, now what will happen? Some physician will come and cauterize it or remove it. The Psora will go in the background. The miasm will go in the background. Okay, and this is the state when the miasm is lying latent inside. Okay, miasm is lying latent inside. No show up in the healthy year of youth. Aphorism number 78, footnote. Aphorism number 878, footnote, 6th edition. Got it? Now please read
yes,
it.
sir.
Please read it.
During the flourishing year of youth and with the commencement of regular menstruation, joined to a mode of life beneficial to soul, heart and body, they remain unrecognized for years. Those afflicted appear in perfect health to their relatives and acquaintances.
What is they? We have discussed this. What is they? They is here chronic miasms. They remain unrecognized. Okay? They remain unrecognized. There is chronic miasm. Read this again.
Whole para.
No. Those afflicted appear in perfect health.
Those afflicted appear in perfect health. to their relatives and acquaintances, and the disease that was received by infection or inheritance seems to have wholly disappeared. But in later years, after adverse events and conditions of life, they are sure to appear anew and develop the more rapidly and assume a more serious character in proportion as the vital principle has become disturbed by debilitating passions, worry and care, but especially when disordered by inappropriate medicinal treatment.
Okay, in the later years, when the adverse conditions are life, this is when the some adverse condition is so much that these are arousing the Psora or arousing the miasm to the giant, means to the full-fledged disease. But some conditions, exciting causes, what we have read in aphorism number 73. Okay, individual exciting causes. Go to aphorism number 73. 1, 2, 3, 4, 5, 6, 7. A transient, seventh line, a transient explosion of latent Psora, which is
Yes, sir.
continuously returns to its dormant state. Okay, individual acute disease. Okay, underline that. That is a transient explosion, and this explosion may last longer and convert to a full-fledged chronic disease. Okay, and may be of acute nature and again returning to its base. Okay, clear? And this mostly happen in the artificial treatment of these diseases when this Psora is becoming more full-fledged chronic disease. Palpable chronic disease was seen, and due to those artificial poking, artificial medicines will arouse this Psora to such an extent that it has developed in a full-fledged disease. So this is the latent stage. Only the latent symptom of Psora are given in Robert also. Okay, no latent symptom of psychosis is given, no latent symptom of syphilis is given. You will find these latent symptom uh, in the Metria Medica, in the proving of medorinum, in the proving of syphilinum. Provings of syphilinum, all the symptoms, all the functional symptoms are being taken as the latent symptom of syphilis. All the symptoms of medorinum proving, all the symptoms in the proving of medorinum are being taken as the latent symptom of psychosis. And we have not given latent symptom of syphilis and latent symptom of psychosis. Okay, we have collected these latent symptoms of syphilis and psychosis. You will get this in some modern textbook on miasm, that these latent symptom are actually the provings of syphilinum. Read the provings of syphilinum and you will get an idea of latent symptom of syphilis and latent symptom of psychosis. Wherever we are getting this latent symptom in Roberts, we will pointing this out, like criminal mentality, jealousy. What are these? The latent symptom of psychosis, latent symptom of syphilis. Okay, like this. Now read the latent symptom of Psora. This was on the mental level. On the physical level, you will get also the latent symptom of psychosis and latent symptom of syphilis. Okay. Now let read some manifestations of latent Psora.
In the last chapter, you learned something of the acute manifestations of the psoric stigma, beside the manifestation of acute diseases, which are all directly traceable to the eruptions of psora. The vital energy often places the psoric poison in a latent state, where it may lie for a
Underline this:
long
directly
period.
traceable to the eruptions of Psora. Directly traceable to the eruptions of Psora.
The vital energy often places the psoric poison in a latent state, where it may lie for a long period, sometimes for years, without manifesting much disturbance, except that the observant physician may read its peculiar characteristics, even in that latent state, and even though the patient is not disturbed to any degree. During
Next.
this latent state, During this latent state, it requires only a slight shock to the vital energy to bring this miasm or stigma to the fore and make its presence actively manifest in an acute disturbance. This acute manifestation may be due to any one of many different causes. It may be due to an accident, to an exposure, or to any other seemingly slight cause. But whatever the direct cause of the acute manifestation, it will show the poisonous effect of the stigma. And it is well for the physician to be conversant with the characteristic of the latent state so that he may cure the underlying dysplasia in the latent condition and thus head off the acute manifestations, thus protecting the resistant power of the vital energy against the sudden strain and helping to eradicate the psoric poison.
Okay, underline only slight shock, underline to bring this miasm or stigma to the force. Okay, only a slight shock, an accident, an exposure, seemingly slight cause. बारिश में भीगने की वजह से बहुत लोग बीमार पड़ते हैं, बहुत लोग नहीं पड़ते हैं. जो लोग बीमार पड़ते हैं, जो लोग नहीं पड़ते हैं, both are soric. ओके, बारिश में भीग गए, दो आदमी हैं, दोनों सोरिक मैनिफेस्ट है, दोनों के अंदर सोरा है. बट जो लोग बीमार पड़े और जो लोग नहीं पड़े, दोनों में डिफरेंस बता सकते हैं? एक आदमी बीमार पड़ा, एक नहीं पड़ा. व्हाई?
It depends on the susceptibility of patient.
सडन एक्सप्लोशन ऑफ सोरा की वजह से जो है द ड्रेन
वो तो हुआ, और जो बीमार नहीं पड़ा वो, जो बीमार नहीं पड़ा वो,
their susceptibility.
Yes, susceptibility, but why you are forgetting the theory of vital force? What the vital force we have read in cure in disease, vital force is playing a much stronger role. Okay, so if the vital energy is more, okay, the correct answer is for susceptibility. Okay, but susceptibility is due to what? Is due to vital force. In one person the vital force was that strong that उसको ले लिया, absorb कर लिया, वो shock ले लिया. In another, vital force was not that strong. Okay, so उसको नहीं ले पाया. Clear? The vital energy, सोरा मान लो दोनों में एक ही फोर्स के साथ था. ये एक आदमी है और ये दूसरा आदमी है. मान लो दोनों में सोरा का फोर्स 50 था. ओके, दोनों में सोरा का फोर्स 50 था. ओके, दोनों में वाइटल फोर्स का फोर्स एक जगह पे, यहां पे 70 था वाइटल फोर्स का फोर्स, जो 50 इसमें खर्च करके रखा हुआ है और 20 एक्स्ट्रा रखा है अपने पास. मगर इसमें 50 ही था जो इसको पकड़ के रखा था. अब इसके पास बाहर का शॉक लेने की और जगह नहीं है. देयर इज नो स्पेस टू टेक एनी फर्दर शॉक. ओके, तो इसको रेन का शॉक मिला, इसको भी रेन का शॉक मिला, ये एक्सप्लोड कर गया. ओके, ये चला गया और ये इसका 20 जो एनर्जी वाइटल एनर्जी था उसको शॉक एब्जॉर्बर की तरह काम किया. ओके, समझ में आ रही है बात? आर यू गेटिंग मी? सो दिस इज द वाइटल एनर्जी which is blocking the sora. What is written here? This is the vital energy, often place the fourth line, vital energy, first para, fourth line. Vital energy often places the soric poison in latent state. Who is placing the soric tent in the latent or any other miasm in the latent tent? कौन पकड़ के रखा है उसको? पकड़ के कौन रखा है? वाइटल एनर्जी. तो अगर वाइटल एनर्जी या सोरा का फोर्स बराबर है तो एक्सटर्नल सोर्स सहने की शक्ति कम हो जाती है. ओके, एंड वाइटल एनर्जी और वाइटल एनर्जी का फोर्स ज्यादा है, सोरा कम है ना, उसको पकड़ के रखा हुआ, एक्सटर्नल फोर्स भी ले पा रहा है. ओके, शॉक ऑब्जर्व कर पा रहा है. दिस इज इम्यूनिटी बोलो, इसको ससेप्टिबिलिटी बोलो और इसको वाइटल फोर्स बोलो. द कंसेप्ट ऑफ वाइटल फोर्स इज नेसेसरी. इन दैट सेंस यू विल बी एबल टू जज योर पेशेंट. ओके, and according to that judging where it is going to affect the selection of doses, selection of repetition, when you are going to repeat, when you are going to adjust the dose. Okay, this we will read when we will study posology. Okay, now read next.
One of the strongest characteristics of Psora in its latent state is the mental condition. Psoric patients are
mental condition. Okay, psoric patient are alert, underline, quick and active, underline. This para, work like Trojans for a short time, but they are fatigued, both mentally and physically, easily fatigued. And thus encircle the word fatigue. Find the word fatigue, both mentally and physically. Fatigue, थक जाता है, बहुत easily थक जाता है. Next, desire to lie down. Underline this. Desire to lie down. This fatigue is accompanied by desire to lie down. This desire is quite characteristics. We have read in the previous chapter. Okay. Next para. A peculiar characteristics of mental irritation is that it produces sense of bodily heat. We have read this. Hotness, hot flushes. Okay. Even you are getting children that all of a sudden I am getting hot flushes. Okay. And heat of the room oppresses them, though they are chilly, but heat of the room oppresses them. Next, anxiety. Find the word anxiety. In next para, anxiety. Around this word, you can roll all the psoric manifestation. Anxiety. In next line, in next para, find the word fear. Fear. And encircle it. Fear. In next para, find the word restlessness. Restlessness. Okay. And last line of this para, this restlessness is particularly noticeable at new moon or if in women at approach of menses. This is one of the characteristics of Psora, the restlessness before menses. Okay. Or restlessness before or during new moon. Okay. Restlessness before attack of convulsion. Restlessness before attack of convulsion. Which medicine? Which medicine?
Cupromet.
Argentum nitricum. Convulsion preceded by great restlessness. Convulsion preceded by great restlessness. We have heard a case of our teacher that the children was before having convulsion. Patient party told Dr. Babu, আমরা জানতে পারি যে কখন যে এর convulsion আসবে. So doctor asked, our teacher asked how, and he told that একদিন আগে থেকেই गाछे उठा शुरू करे. एक दिन पहले से इतना रेस्टलेस हो जाता है कि पेड़ पे चढ़ने लगता है, इधर उधर घूमने लगता है, दूसरे दिन कन्वल्शन आ जाता है. तो convulsion preceded by restlessness. This is a side topic, not necessarily a psoric manifestation, but in psorinum you will get a line, feels unusually well before the attack. ये भी कर रहा है, वो भी कर रहा है, I'm very fine, this and that, and the next day they will get the attack of any illness. Okay, this restlessness before approach of menses, at the approach of new menses, new moon. Next paragraph. Read next paragraph.
From here, the change of temperament.
Yes, from where? From there.
The change of temperament without any apparent cause is part of the cycle. They become hysterical and go into fits of temper. Young people particularly become hysterical, especially after acute weakening diseases. Psora has fits of anger, yet with these fits of anger.
Acute weakening diseases. Underline this, and we have read falling of hair after illness is also a psoric manifestation. We have read yesterday. After acute disease, appetite will not return, a symptom of psorinum. Okay. After acute disease, what is acute disease? Individual acute disease, what it is? It is the latent explosion of Psora. That is why we are telling this is a psoric manifestation. Next.
Psora has fits of anger, yet with these fits of anger, there is seldom any desire to harm others in purely psoric cases. But if the psoric base is united with psychosis or syphilis, there is a decided tendency to harm or even to kill others.
Okay, underline this. What is the anger of natrum self? What is the anger of natrum self?
It controls the structure.
Okay, try to kill himself.
कंट्रोल करता है.
Have to, हाँ, खुद को कंट्रोल करता है, खुद को मारने से भी कंट्रोल करता है. And this natrum self, yes,
Shooting, by shooting.
what you're telling, I'm not getting.
गुस्सा इतना ज्यादा होता है कि वो अपने आप को शूट कर लेना चाहता है.
हाँ, अपने आप को शूट करना चाहता है. That is to desire to harm others or himself. Syphilitic patient will harm himself also. Okay, not psychotic. Psychotic patient will always try to harm others, but syphilitic patient will harm himself also. And we know that this natrum self has a strong psychotic basis. Yes.
Yes.
Yes, yes.
Yes. Next. So this is what the miasm knowledge of and understanding of miasm will help you to decide your medicine, will hint you towards the medicine. Okay, those who are telling like Hughes school, Herring was not accepting. You will be shocked to know that Herring was not accepting the chronic diseases, theory of chronic diseases, and we have already told the Hughesian school is all and all against this idea of miasms. Okay, Hughesian school. And there are people who are telling that this miasm is nothing, but these are something, and it is very helpful in deciding your prescription. Next.
The greatest force to rouse the evil of the psoric dyscrasia is grief or sorrow. These emotions seem to have particular power in bringing out the exacerbation, and people under the influence of grief and sorrow will often develop immediately some acute sickness.
Underline this. Develop immediately some acute sickness. And this acute sickness may recover. This acute sickness may recover or may prolonged in a chronic disease. Okay? May prolonged in the chronic disease. Next.
Psoric patients have much depression of spirits. If the patient is a woman, she will suddenly burst out crying, which relieves the whole condition. When they get into this depressed condition, everyone knows of their troubles because they are not accustomed to silent grief. Melancholy patients on awakening from sleep have heart of palpitation and they become nervous and anxious with a sense of constriction about the heart. Then they will have flushes of heat.
This is sense of contraction is what? This is a subjective symptom, no? And Psora is full of subjective symptom. Next.
These conditions, they will pass from depression of spirit into moodiness, sulkiness, or fits of temper, then suddenly come out of these moods and act like entirely different persons. The psoric disturbances possesses the very life force, and it is so fundamental in the patient that in order to meet the disturbance, a remedy having a marked similarity in the mental trait must be used to overcome the stigma. Psoric manifestations are ameliorated by the eliminative functions, and conditions such as diarrhea, perspiration, or even a free urination may ameliorate the conditions. The psychotic
This is very important. Just encircle the psoric. Encircle the psoric. This will help you throughout your academic career as well as your professional career. That psoric conditions are ameliorated by eliminative functions. Natural discharges ameliorate. Okay, perspiration, free urination. Okay, loose stool. Not diarrhea. Diarrhea will be sometime a disease, but sometime purging out the loose stool. Stool is normal but loose. Okay, that purging out ameliorate the condition. Okay, instead of diarrhea you can write loose stool because diarrhea may be a diseased condition, but natural eliminative processes, urination, stool, okay, urination, stool, perspiration, all these are excessive menstruation, all these are not leukorrhea, all these are eliminative function. Okay? All these are eliminative function of body, and is greatly ameliorated by these eliminative natural avenues of elimination. Okay, encircle soric, and then underline amelioration by eliminative functions. Next, psychotic, in bracket you will see psychotic, encircle that, and next underline manifestation we find general amelioration from elimination, but not through perspiration, diarrhea, or urination. Okay, general amelioration from elimination. Okay, these general amelioration is from what? Unnatural discharges. Okay, in psychotic is ameliorated by unusual elimination from mucus surface, such as leukorrhea, nasal discharges, like that. We have read a syphilitic headache ameliorated by nosebleed. Okay, same way it is psychotic for unnatural discharges. But in syphilis, natural discharges aggravate the condition. Mercury में क्या हो रहा? Mercurius में क्या हो रहा था? Perspiration, profuse perspiration, which is aggravating the condition. Okay, we will read it again in next chapter. Read next.
Pathological developments very rarely take place under a purely sphoric manifestation. It is only when this taint is united with another stigma that pathological condition arise. And when the two or three are united in the same individual, the vital energy is not powerful enough to overcome the pathological formation. Malignancy is developed in the presence of the combined stigmata, and for that reason, these conditions are difficult to treat and are impossible of real cure under any form of treatment except by stimulating the vital energy. Other conditions difficult of treatment, such as epilepsy and true insanity, are also manifestation of combined stigmata. These are usually tubercular in their origin, being a grafting of the syphilitic on the psoric fault.
I was disconnected for a while. Please read it again.
From the beginning, so
From here, malignancy is developed in the presence of combined stigmata.
malignancy is developed in the presence of the combined stigmata, and for that reason, these conditions are difficult to treat and are impossible of real cure under any form of treatment except by stimulating the vital energy. Other conditions difficult of treatment, such as epilepsy and true insanity, are also manifestation of the combined stigmata. These are usually tubercular in their origin, being a grafting of the syphilitic on the psoric fault.
Underline this. Underline epilepsy, underline true insanity. Underline combined stigmata, underline tubercular in their origin, and here is the definition for tubercular diathesis: syphilitic grafting on the psoric fault. Underline definition for tubercular diathesis according to Robert. There was a call again. Sorry. The vital force, or this is the definition. I was telling that this is the definition of tubercular state according to most popular notion that this tubercular state is nothing but grafting of syphilis on psoric fault. Okay, this is a complex disease or a double complex disease made out of Psora and syphilis, according to Robert and many other stalwart. According to JHLN, this tubercular state may be due to Psora also. Okay, next paragraph. Read next paragraph.
The vital force or vital energy cannot long endure disturbances to remain latent where more than one stigma is present. Psora seldom, if ever, develops pathological manifestation when it is alone, and the trouble may remain constant. But where there is more than one basic dysplasia, one is at once inflamed by the other, and disturbances manifest themselves. When one of the latent conditions is Psora, it is stirred in all its power, and all that is destructive, hateful, and menacing in the psoric stigma will be the first to appear.
Okay, whatever will be dominant condition, that exciting cause will poke that miasm. Okay, read next.
In treating the combined stigmata, the most outstanding must be treated first, since we base our method of treatment upon symptom similarity, and where Psora is present, Psora will be the most outstanding in the symptom totality in the earlier manifestation.
Underline this.
This
Underline this line. Where Psora is present, from there to earlier manifestation. Underline this. Whichever miasm will be present, they will be showing its symptom first. This manifestation must be treating first. Then, after eradicated or considerably lessened, the next most potent dysphagia, as itself expressed. Okay, you have read in the Kent philosophy, change of plan of treatment, where the patient all of a sudden comes and tell you that I am having this type of sore throat or this type of discharge. Okay, and you ask your patient that have you suffered from syphilis in any other time of life. He accepted, and you change your plan of treatment. This is all about changing your plan of treatment according to predominant miasm, layer by layer. Next, read next.
This manifestation must be treated first, then after that is eradicated or considerably lessened. The next most potent dysplasia, as it expresses itself in the symptomatology, must be treated until this too is eradicated. The treatment should continue in this way, each time treating the most dominant stigma as expressed by the outward manifestations until cure is attained.
Underline this, as expressed by the outward manifestations, by the symptoms, by the pathology. Okay, next.
We are fortunate that many of our most deeply acting remedies have the ability to meet and deal with more than one of these deep underlying conditions. Therefore, it is not always necessary, if a remedy be carefully selected, to zigzag a chronic case towards cure.
Underline this.
Nevertheless,
Therefore, it is not always necessary. Not always. There are instances we are zigzagging the cure. Okay, by successive utilization. Where we are zigzagging the course of the cure, where the symptoms are less, one-sided diseases. Zigzagging, successive medicines are given. Okay, so our medicines are covering multi-miasms. So there are medicines which are deeply acting and covering the multi-miasmatic totality of the symptom. Next.
due to Hahnemann, Hahnemann's great discovery of this basic stigma, Sora and his pointing the way in which it can be met, the homeopathic physician has the power to forestall the destructive processes of many chronic diseases and to stop the development
Underline
of
this.
conditions.
Wall stall the destructive process of many chronic diseases. Underline this. And to stop the development of the condition that would have inevitable led to fatal terminations. Okay. Forestall. हमको मालूम चल गया. I have know that this patient is of a syphilitic base, and in future this can be going to a carcinomatous condition. Okay. If you are treating from the very early age of that patient won't develop this. Okay. Destructiveness will be halted then and there only. Next, last sentence.
It is the study of these things and knowledge of them and of the way to meet them that gives the homeopathic physician the opportunity and the privilege of correcting in childhood and youth these devastating scourges and developing the future child into his full strength with all of his vital power intact.
Okay, we are treating our children right from the mother's womb. Okay, a homeopath is treating children, their children patient right from the mother's womb. Okay, so this is the advantage for homeopathy, that they can hide in flourishing of year of youth, when apparently there is no disease. Even then we are treating our patient to halt all those future manifestations. Clear? Now we will start from disease classification, next chapter, chapter number 26, next day onward. Okay. Any question if you are having, you can ask so that we can refer to it in next 5 minutes. Any
सर
question?
कुछ केसेस होते हैं, यस सर। सर
हाँ
किसी
बोलो।
केस में क्या है, कुछ मेडिसिन के इंडिकेशंस नहीं मिलते हैं, बट तो हो सकता है कि उसमें सोरिक सिम्टम्स बहुत सारे हों, लेकिन साइकोसिस सिम्टम बहुत सारे हों, सिफिलिटिक बहुत सारे, बट मेडिसिन का क्लियर कट इंडिकेशंस नहीं है, तो क्या हम प्रीडोमिनेंटली एंटीसोरिक मेडिसिन दे सकते हो क्या?
ऑफ कोर्स दे सकते हैं, दे सकते हैं। What is the indication? What is one of the indication for sulfur? Tell me.
Suppose morning aggravations, vertigo,
I am not
functional
one of the tell me a characteristics indication of sulfur. Your case you are telling when suitably indicated medicine fails to act. Okay.
Yes, sir.
Okay, indicated medicine fails to act, and one of the indication for sulfur is also when you are not getting a clear picture. When you are not getting a clear picture and you think that case may be a psychotic one, you can start with thuja. When you are not getting a clear picture and you can guess, you can tell from the family history, past history, the patient, you can start with mercurius or syphilinum. When you are not getting a clear picture but you think that the case is predominantly a soric one, you can start with sulfur. Okay, and then you will get we will start getting the characteristic symptoms. Okay.
Yes.
This is altogether, this is, I have not read anywhere that this is a clinical experience of my teachers and mine. Okay. Still I have to read, don't utter this that I will start with this miasmatic treatment and all. For academic purpose, पकड़ लो इसको, totality. Okay. For practical purpose, all that you can utilize within the limit of homeopathy, you can use. Okay.
So most of the time we face such type of problem in OPD when we have no symptoms of particular medicine. We didn't get any particular totality of any medicine, only symptoms of some miasm, in that case predominant. So we can select a medicine which most probably covering the all symptoms of that miasm. Suppose like sulfur or thuja or syphilinum.
I didn't get your question.
सर ऐसे केसेस में जहाँ पर क्लियर कट इंडिकेशंस नहीं है मेडिसिन के, और जहाँ पर सिर्फ क्लियर कट इंडिकेशन सिर्फ मायाजम के ही मिल रहे हैं, तो मोस्ट ऑफ द केसेस में मैं फेस किया हूँ, हो सकता है कि मेरा नॉलेज उतना नहीं है, तो इस वजह से मैं जस्ट एक एंटीसोरिक मेडिसिन सेलेक्ट कर लेता हूँ, या फिर जस्ट जो प्रीडोमिनेंटली सोरा को कवर कर रही है या फिर साइकोसिस को कवर कर रही है।
सही है, ऐसा ही है। प्रीडोमिनेंट माइजम एंड प्रीडोमिनेंट तुम मेडिसिन सेलेक्ट कर ही सकते हो।
तो लेकिन हमें और किसी मेडिसिन के इंडिकेशन समझ नहीं आ रहे, तो हम जस्ट सल्फर ही सोचते हैं ऐसे केसेस।
सोच सकते हैं।
Excuse me, I have an objection. Yeah, I have an objection with this questions. I think if he is telling, I am getting the picture of some miasm or some dominant miasm, but I am not getting the picture of some medicine, it is impossible. I think if I am getting the picture of miasm, that will definitely indicate the symptoms of medicine, symptoms of disease itself. So this is our deficiency in knowledge, I think, that we are not able to find that medicine according to that mathematic symptoms. Because if we are getting sign and symptom in the patient which is indicating some dominant miasm, this will be certainly will be present in some medicine. But this is a lack of knowledge that we are not able to correlate that symptoms with that medicine, I think. But I think this Mr. Sunil, Dr. Sunil is taking these MASM and medicine and disease in three different levels. But this is not, I think, different. This is all the same thing. What we are getting in disease, this will indicate a MASM and this will certainly indicate a medicine. In my opinion,
Okay.
I don't know.
Okay. What? Do you agree with this, Sunil?
Yes, yes, I'm agree because it is
I
my
think
fault.
what you are telling actually, what your case should be, what Dr. Priyanka have told is very correct, that if you are getting a clear-cut indication for some miasm by some symptoms, and if you are not getting the medicine of your choice, it cannot be. You can select your medicine on the predominant symptoms available, okay, and that will eventually cover the miasm part, okay. That predominantly soric symptoms will hint you toward the selection of anti-soric medicine, okay. Next condition may be there, that you have given your medicine and it is not working. What to do in that case? Okay, I think this should be the
In that
question.
case, I think, yeah, in that case, we will give any which miasm is predominating. We will give anti-miasmatic treatment to remove the blockage or to means clear the picture more clear picture पाने के लिए हम उस time anti-miasmatic treatment देंगे. But
And
that
again
anti-miasmatic
okay,
that will
yes,
also
yes,
depend
complete.
on the symptoms of the patient.
That will also depend on the symptoms, and
Yeah.
sometimes that obstacle to cure we are finding in miasm, in personal history, in family history, and in accessory circumstances. If my medicine is not working, search out these sphere of the patient: accessory circumstances, personal history, past history. Okay.
Yes, sir.
Okay. Anything more to add, Dr. Priyanka? Anything more you want to add?
No, I have one question that you told that we are giving medicines in means for a child also means for a fetus in mother's wombs we are giving medicines to the pregnant lady. So this is also
Yes.
written in I think 284 footnote, I think, if I am correct. So
Yes.
there
Yes.
it is
Fifth
written.
edition. You are absolutely
There,
correct.
yeah. So there it is written that mild antiphoric treatment or sulfur it is mentioned. So means
Mhm.
this is all about theory what I know, but practically I want to know if I am giving sulfur to a pregnant lady in which month, means on the basis of some symptoms any antisoric will be given, or as a rule we will give a sulfur to that pregnant lady if we are giving that
No, sulfur
sulfur
तो
to
नहीं
the
लिखा हुआ है. Any other antisoric according to the indication. According to the indication. Any other antisoric.
okay to
If sulfur is indicated, sulfur is well and good. If any other indications, we have read in the last
no,
class
this
that
I think this line, but the case of mothers in their first pregnancy by means of a mild antisodic treatment, especially with sulfur dynamization, prepared according to
okay,
the direction in this edition. Yeah.
okay, like antisoric treatment and especially sulfur, both are included. Both are
Okay.
included.
So just
If you want,
my query
yes.
is that if I think means if mother is not sick or not ill, on the routine prescription we can give sulfur in any stage or any month of that pregnancy for means sodic taint of that child, means to prevent that
If,
any sodic
if mother
manifestation,
is, if mother is, what if mother is not fit,
means mother is
not
not
ill?
sick, means Yeah.
Not sick. Okay, not sick. Okay.
On preventive.
Even if mother is not sick.
Yeah.
Yes.
So
We
for a
can. Why
preventive
we are
purpose.
giving tetanus injection to mothers?
Yeah.
Why we are
Pardon?
giving tetanus injection as a routine to mothers?
Yeah, for that
To prevent the
prevention of tetanus.
posterity in advance.
Yeah.
To prevent the posterity in advance. That is why we are giving.
Okay. Then my query is that in this is all about theory, what I know. But my query is
Okay.
that in your patient clinic or in your clinic, you gave this sulfur to any pregnant lady? If you gave, then in which month you are preferring this sulfur to be given to that pregnant lady?
In earliest, the earlier you start, even I am suggesting that nowadays before conception you start treatment of parents. The
Okay,
earlier
I
you
told
will
that if
start,
the parent
the
is not sick.
greater result you will get. Okay, the first trimester is the moment where the antisoric treatment should be started according to the indication. Whatever the indication we are getting. Okay, whatever the indication we are getting. Even if we are just prescribing symphoricarpus, we are just prescribing our thyroidinum. These are the antisoric. These will be considered as antisoric treatments for the child. Okay, along with the mother. Even if the mother is not sick, consider giving antisoric medicine basing on the desire mother is having. Okay, desires in pregnancy, you will get different sort of desires, different sort of physiological symptoms. On that basis, earlier you start, the better you will get result. Okay, the earlier first trimester is very important for the fetus because it's a development of genesis of the organ. All the organs have means genesis of all the organs is completed in the first trimester. Okay, the earlier you start the homeopathic treatment, the better you will get the result. And my opinion, you should start the treatment of the parents before conception. Now the days are of family planning, so why not plan this also, that if a beta thalassemia carrier mothers are there or parents are there, when you will start the treatment for them. Okay, before the conception, before they are planning to have a baby. Okay, so that this dyscrasia they are carrying should not go to the baby. The earlier you start, the better result you will get. In which
Okay,
month?
this is
I
all.
hope
Okay,
this is the answer to your question. The earlier you start, the better result you will get.
okay. This is all for that if the parents are sick or any suffering the mothers is having. But my
Okay.
question is still that ki, as a preventive we can use sulfur if mother is not sick, no any indication. But as a routine
No,
prescription we
it
can
is,
use.
you are bound to get any indication in pregnancy.
Okay, okay, okay. Now I got.
The physiological changes will produce some symptoms, even if it
Okay.
is frequent picturation, even if it is heaviness of body, even if it is quite morning sickness, even if it is the late night sleep, cannot sleep on account of, even if it is anxiety, you bound indication. And suppose that you are not getting any indication, you can use your sulfur.
Okay, but in which month it is means safer to use sulfur in which month?
In which
Any
month it
means
is safer?
yeah.
Homeopathic medicines are
Because
always safer.
one of doctor I means I can say one of colleague who is pregnant and she asked me when to use sulfur if I am pregnant. Means practically she was asking because I also read in the theory but I never used sulfur in pregnancy.
Earlier you give, if you have any other, no any other indication for any medicine, no any other indication for I mean the sickness of the mother is very healthy and no other symptoms are there, the earlier you give, the better you get the result, and no chance of any damage to the fetus with this sulfur 1 or 2 doses. Okay,
any
even
potency means
30,
minimum means 30. Okay.
minimum 30. You can repeat it every 2 months or 3 months.
Okay. Thank
Okay. Recently, I have given carcinosin 1 m to a mother.
you.
Okay.
Uh,
And I am planning to repeat it because she is having a strong family, syphilitic family history, strong carcinosin, cancer history in the family, okay, and other peculiar desire of chocolate and desire to lie down on the abdomen. Okay, these were the symptoms I was getting, and to I thought that it will be useful not for only for the patient but also for the fetus. So I gave carcinosin 1M. There is no danger of to the fetus. Okay, there is no danger. Homeopathic medicine are not acting on the physiological level. All we know.
Thank
So
you.
the ultimate danger can be, the ultimate danger with the homeopathic medicine can be of loss of pregnancy, abortion, and that is not going to happen with our medicine. Be sure of that. If you are not repeating it again and again, frequent repetition, large doses will do some physiological damage, but a single dose of a highly potentized medicine is not going to harm your fetus. And structural changes to nothing, structural changes can be there. Okay, no structural changes like that crude medicines of allopathic. Homeopathic potentized medicine in minimum dose with seldom repetition is very useful and very helpful for the fetus. Okay, and earlier you
This is
start,
just,
the better result you will get. You
yeah,
can
this is
give
just
on the
opposite of
indication of
allopathy.
family history.
Yeah.
Yes,
This is just opposite of allopathic medication, because the
yes,
allopathists means that modern science are not giving medicine in any medicines in the first trimester. I mean, they are restricting, or they are telling or advising you not to use any medicine the first
because you know
trimester
that
because of
this is the
yeah,
genesis
organogenesis
organ.
period. Yeah.
Yes,
Okay, thank you so much for answering my queries. Thank you.
thank you. Thank you
Thank you.
for giving attention. Okay, Sunil, are you telling something?
Oh, so thank you, sir.
Okay, you're most welcome. I cannot continue it further. Discussion was very interesting, but I cannot forget means lending the discussion because I am feeling a bit sick today. Thank you.
Okay, so